The mouth is one of the connections into the whole body. Patients that have other systemic issues going on are often much more likely to have gum disease. And so patients that have inflammation like diabetes, heart disease, in other parts of their body are actually more prone to gum disease, but also have worse bouts with the gum disease. So not only can getting the gum disease under control help the inflammation in the rest of their body, but they play off each other, and also keeping your diabetes under control, your blood pressure under control, that can also help your gum disease have an opportunity to heal. So having good systemic health in addition to good oral health really play right beside each other and help work off each other. So we always encourage our patients to not only have good oral health, but also have good systemic health.